Please raise your hand if you own a pet. I too own a pet. Who has ever experienced the loss of a pet? Like, you have? Okay, great. Have you ever had to put your pet down? Have you ever had to get your pet euthanized? Whether it was you couldn't care for them, or they had cancer, or they had like a tumor, or they were just old and you felt bad, or maybe you couldn't afford a pet anymore, or something happened and you had to put them down. I too have done this. I actually had to do it one time for Christmas. But I am Giovanna Velez, and my topic is euthanasia and physician-assisted suicide. What is euthanasia? Euthanasia is the painless killing of a patient who is suffering from an incurable and painful disease, or maybe they're in an irreversible coma. Things like Alzheimer's disease, dementia, schizophrenia, and sometimes people who are handicapped and they can't move their body, often in wheelchairs and they can only turn their head, often undergo euthanasia. And euthanasia is legal in the Netherlands, it is legal in Belgium, it is legal in Colombia, it is legal in Luxembourg, and in Canada. Physician-assisted suicide is legal in Switzerland, Germany, the United States within certain states, and the first state in America that actually passed a law regarding physician-assisted suicide was Oregon in 1994. And since then, we've adopted a lot, and I believe the most recent state that adopted it was the District of Columbia, Washington, D.C. Now, what is the difference between physician-assisted suicide and euthanasia? A lot of people think they're the same thing. They're not. Physician-assisted suicide takes away the liability from the doctor, whereas euthanasia allows the doctor to put the injection within the individual's arm. Not to mention, like a more clear example, in Switzerland, if I requested physician-assisted suicide because maybe I had Alzheimer's, they would give me a cup, or they would give me a cup of water with pills to take, but they wouldn't force the pills down my throat, because then they have the liability of killing me. Whereas I commit my own suicide, but they assist me by giving the means in which I can end my life. There are two types of euthanasia. Voluntary, which means that's the individual who gives consent to euthanasia, and involuntary. So an example of involuntary is your classic, you're in the battlefield and your friend really wants to be saved, but his leg is blown off and he's bleeding too much. And so instead of bringing him back to base with you, you give him methane and you kill him by putting him down in a painless way. There's also two more types. There's active and there's passive. Active takes direct action, so like giving a shot or cutting them off life support. And passive is like stopping or limiting. So if like there's an elderly person who needs pills, like a certain amount of pills, certain milligrams a day, if you start restricting the amount of pills they take, that is working towards euthanasia. Or sometimes you see this a lot too, is like families can't afford life support anymore, or they can't afford medication, so they start cutting it down. Because doctors are the ones in regards to euthanasia who decide whether a patient should be administered euthanasia if they see fit that they are really like struggling, they're not doing well, they really are in pain. They're the ones at the end of the day who make the call. The requirements for a doctor to check whether or not a patient is able to get euthanasia is the patient has to make 2 orals and 1 written request for it. Each one of these have to be like 15 days apart. So that way like the doctor can tell like the patient has enough time to think it over, and the patient does not have impaired judgment, because that's a really big thing. If I'm gonna kill a patient, or if I'm gonna administer something that could take the patient's life away, I don't want them to be mentally handicapped, because as a doctor you wouldn't want them to end a life that they really don't want to end, because they don't really understand what death is. A lot of people use the same requirements for physician-assisted suicide. I know in the United States we actually use all 3 of these, and we add a 4th one, which is you have to be 18 years or older. But for the most part, they're the same requirements. If they see that a patient is in dire pain and they request for dying, doctors often go ahead with that request. Whether or not, like, in the country they do have euthanasia or physician-assisted suicide, I saw that in a lot of research that a lot of patients who really do want to pass, even if their country doesn't really legalize it, they still try to help in whatever way they can. Like, again, they do it more of a passive way, like limiting the support in medication or not giving them the right prescriptions. About 260 out of 415 physicians who were surveyed agreed in aiding an individual dying. So that is about 63% of people who aided in patients dying. Such data was gathered and presented by Diane Muir and her research team in their investigation regarding to the characteristics patients had that requested physician-assisted suicide. Now here I have a quote. It says, "I request that my attending physician prescribe medication that will end my life in a humane and peaceful manner." This is directly from Oregon's law, the Death with Dignity Act. That's what they call it. As I mentioned before, a lot of states like Washington, D.C. has adopted this, and my goal is to hopefully have the entire 50 states adopt this. According to their Death with Dignity Act, in 2018, so last year, 249 individuals received their prescription, and only 168 people actually died from taking their prescriptions. This has increased from 2017, when only 219 people received the prescription and 158 died. So we've only seen about an increase of 10 people who actually died from their prescriptions, but far more people who actually asked for the prescriptions to end their life. A lot more states are seeing a similar pattern as well, that people are becoming more accepting of the idea for people who are suffering from mental diseases that causes a lot of pain, or that allows them to not do as much as like other people, to go ahead and pass on by requesting such from their doctors. According to a study conducted by Peria, they discussed that the reality of safeguards are often overlooked in regards to euthanasia and physician-assisted suicide. So what this means is that people often feel that they're not really talking about, like, there was a case within a podcast that I was listening to where a son felt that his mother didn't want to go, although she was battling severe depression, and I believe a few other diseases mixed in. Can't remember off the top of my head, but he felt that it was the doctor who murdered his mother. And so because they don't want doctors to feel like that they were the ones who murdered, because that's manslaughter. That's killing someone without consent is manslaughter. They didn't want that, so the doctor spoke to the son and they said, like, your mother told me not to tell anybody because she wrote it here, and as a doctor, it is between you and the patient. So if I choose to go through with euthanasia or physician-assisted suicide, depending on whichever one I choose, whether the doctor is liable, so in this case euthanasia, I have the say whether or not my parents, because I'm an adult, I can say whether or not I want them to know. And so it is the doctor's responsibility to hold this and to respect their opinions. And this is a cute little like graph that shows about how many people have died from taking prescriptions regarding Oregon's Death with Dignity Act in terms of like the prescriptions. This bad boy started in 1994, but it wasn't enacted until October 27th, 1998. So from here we start seeing the increase, and I believe it'll just keep going up. So concerns that regarding both euthanasia and physician-assisted suicide is that according to a study, specifically the one I mentioned earlier about Peria and how like they saw like the safeguards, 900 people are administered lethal substance without having explicit consent. So there is a research in Belgium and in the Netherlands that they saw that 900 people were administered euthanasia, but they didn't explicitly give consent. And then this raises kind of a few concerns regarding like if it was passive, if it was active, if it was with consent, or like what type of situations they were in. Because sometimes an individual won't give you consent in the moment, but in their living will. So if they end up developing dementia or something that doesn't like impair their judgment, if they have a will that says, I want euthanasia, or I want to be helped with physician-assisted suicide when I can no longer think for myself, the doctor listens to that because that's what the patient wrote when they were mentally stable and mentally well. And then what's something really interesting within that same research is that in the Netherlands, they've changed their law. And so anyone now who's 70 years of age can request for physician-assisted suicide. they can pass if they're quote-unquote tired of living. Originally, euthanasia and physician-assisted suicide was one of the last resorts. It's becoming now one of the top 3 resorts patients go to, determining what type of illness and disease they have. Learning from the Netherlands, I think the mistakes that they made can help the US improve their laws regarding euthanasia and physician-assisted suicide. I also feel that the American people can learn a lot more from those people who do enact physician-assisted suicide and euthanasia. A study that was conducted by Ezekiel Emanuel and a few other researchers used a survey to determine the attitudes and desire of euthanasia and physician-assisted suicide within these patients who are terminally ill. The patients had found that about 60.2% supported euthanasia and physician-assisted suicide, and that some were worried about receiving it when they're older without consent. So they were really scared that, I believe it was a lot of elderly people that were okay with euthanasia, but within the article it was a lot more people who had terminally ill diseases that were within their mid-30s to 50s that were that they felt a strong concern for dying without having consented to an injection. They were worried. These people, specifically as I mentioned, were less than 65 years on average. According to another study, Jane Bolin, a researcher who in Belgium saw potential to help those on the waiting list for various organs by speaking and putting into perspective how individuals who undergo euthanasia can help others. So something positive from euthanasia and physician-assisted suicide is that we can take the organs from these people as long as they wish to donate their organs, and you can use it for other people. So if somebody needs a heart, if somebody needs a lung, if somebody needs a kidney, you have now another pool of people that you can take these various organs from instead of waiting for healthy people. And you can see if they're compatible with the donors. Instead of waiting months, you can get it sooner. At the end of the day, it is the own person's idea whether or not they want to undergo euthanasia. At the end of the day, it is their choice whether or not they would like to pass or continue living despite their incurable disease, or whether they're in a coma, or whether how much pain they're suffering that is so great that they feel like they can no longer go on. But allowing them the choice to stay or to pass, to have access to euthanasia, or to have access to physician-assisted suicide, depending on what country you're in. That all remains up to us, the people of the United States, to help legalize physician-assisted suicide in all 50 states, and I believe it is in our best interest to do so. Thank you.